Vitamin A, while essential for numerous bodily functions, can pose significant risks when it interacts adversely with certain medications. These interactions can amplify side effects, reduce therapeutic effectiveness, or even cause harmful complications, especially when vitamin A is taken in supplement form alongside prescribed drugs. This complexity underscores the importance of understanding how vitamin A may interfere with common medications and highlights the need for medical supervision before combining vitamin A supplements with ongoing treatments. One of the most well-known areas of concern involves retinoid drugs, which are synthetic derivatives of vitamin A commonly prescribed for skin conditions such as severe acne, psoriasis, and certain types of cancer. These medications, including isotretinoin and acitretin, work by modulating cell growth and differentiation, processes closely linked to vitamin A's biological activity. When someone taking retinoid drug supplements with additional vitamin A, the risk of vitamin A toxicity significantly increases. Because both the medication and supplemental vitamin A have similar mechanisms and metabolic pathways, their combined effects can push vitamin A levels in the body to dangerously high thresholds. This can lead to intensified symptoms of toxicity such as severe headaches, nausea, dizziness, and, in extreme cases, increased intracranial pressure, which can be life-threatening if not addressed promptly. Moreover, retinoids themselves already carry a risk of causing birth defects and liver toxicity. Adding excessive vitamin A can worsen these dangers. This is especially critical for women of childbearing age who must avoid vitamin A excess due to its teratogenic effects and who may be prescribed retinoid therapy for skin conditions. Without careful monitoring, the interaction between supplements and medications could result in serious, preventable complications for both the mother and developing fetus. Vitamin A also interacts adversely with blood-thinning medications such as warfarin, Coumadin, posing a risk for altered blood clotting. Warfarin works by reducing the blood's ability to form clots, and this balance is delicately maintained through vitamin K pathways. Although vitamin A is not directly involved in clotting, excessive vitamin A intake may interfere with the metabolism of warfarin and related anticoagulants, leading to unpredictable effects. This interference can either potentiate the blood-thinning effect, increasing the risk of dangerous bleeding, or reduce it, heightening the risk of clots. Both scenarios carry serious health implications, including hemorrhage or stroke, making it crucial for patients on blood thinners to have their vitamin A intake carefully managed and supervised by healthcare providers. Furthermore, medications that impact liver function are of particular concern in relation to vitamin A. Since vitamin A is stored and metabolized primarily in the liver, drugs that affect liver enzymes, such as certain antiepileptic drugs, tuberculosis medications, and some antifungal agents, can alter vitamin A metabolism and increase the risk of toxicity or reduce vitamin A's effectiveness. Conversely, excessive vitamin A intake may strain the liver further when combined with hepatotoxic medications, compounding the risk of liver damage. This interaction can lead to elevated liver enzymes, jaundice, or even liver failure in severe cases, which requires urgent medical attention. Patients undergoing long-term treatment with any of these medication classes must be especially cautious about vitamin A supplementation, because the symptoms of vitamin A toxicity, like fatigue, headaches, joint pain, and liver dysfunction, can overlap with medication side effects. Distinguishing the cause may be challenging without professional guidance. Self-supplementing with vitamin A in these circumstances can mask underlying problems or exacerbate adverse effects, potentially leading to more serious health crises. In addition to these more direct medication interactions, vitamin A's immune-modulating properties may influence the effectiveness of immunosuppressive drugs, often prescribed after organ transplants or for autoimmune diseases. Vitamin A can alter immune responses in unpredictable ways, either reducing the effectiveness of immunosuppressants or increasing the risk of infections and inflammatory complications. This interaction further complicates the management of patients with complex health needs who require tight control over their immune system activity. Given the intricate web of potential interactions, the importance of consulting healthcare professionals before starting vitamin A supplements cannot be overstated. Doctors can evaluate current medications, underlying health conditions, and dietary intake to determine whether supplementation is safe and necessary. They can also monitor blood levels of vitamin A and liver function to avoid complications and adjust medication doses if needed. Unfortunately, many people take vitamin supplements over the counter without disclosing their full medication list to their healthcare providers, increasing the risk of dangerous interactions. Public awareness around these risks is still insufficient, and education about the potential adverse effects of vitamin A in combination with certain medications is urgently needed. Patients should be encouraged to communicate openly with their healthcare team and avoid self-medicating, especially with fat-soluble vitamins like A that accumulate in the body. In conclusion, while vitamin A is crucial for health, its interactions with medications such as retinoid drugs, blood thinners, and liver-affecting agents can lead to serious adverse effects if not carefully managed. These interactions may exacerbate toxicity symptoms, compromise treatment efficacy, and cause unpredictable health complications. For anyone on long-term medication, especially those involving retinoids or anticoagulants, it is vital to consult a healthcare professional before introducing vitamin A supplements. Failure to do so risks not only undermining medical treatment, but also endangering one's overall health through avoidable and potentially severe drug-nutrient interactions.